Hello guys, so today we have our colleague from Karnataka and he visited Samaj State Medical University. So today we will be sharing our support and what he feels about the university, his review about the university and how Study Palace have assisted Dr. Tarun. He also have his own branch and he is our colleague from South India, future doctor, his consultancy. So please sir, please give your reviews about our university.
Hello, I'm myself Dr. Tarun. I'm from Future Doctors Consultancy from Tumkur, Karnataka. Yes, we do work with the Study Palace Health. We associate partners. Yes, firstly I need to thankful for Dr. Rakesh, Dr. Shubham and Dr. Anubhav for creating this great opportunity to visit the Samara State Medical University. I need to hardly say that basically I visited many of the universities in Russia by visiting basically I visited many universities in Russia and Georgia and Caribbean Islands, but I frankly need to say that Samara State Medical University is one of the best university. Why did I mention it is one of the best university? Because it has a really good campus and resources for the students, especially for the medical students to become a very successful doctor. Because most of the students, they think that in outside they won't get good clinical exposure, classes will be conducted in just in a room, they won't be allowed to touch the patients or see the patients, they won't get cadavers, real bodies, there will be practices done on the mannequins or just like a doll sample like that. But no, it's false. In Samara State Medical University, you can see real bodies, real corpuses, patient, like students are allowed to dissect the bodies, mortuaries is there, and as they have been integrated with the 3D technology of the anatomy with the real bodies. So this integrated technology will allow the students to learn in a very effective way. And second thing is that when we come to the clinical side, Samara State Medical University, mostly like in Russia, they will be affiliated with the government hospitals. But Samara State Medical University has its own clinic with the different specialty of the other departments also. So students can easily access to this clinic and they can get the good clinical exposure, which this clinic and hospital is situated in the same campus of the Samara State Medical campus.
And sir, one more question especially. How you find us, like regarding we are already working with past 1 year and you not only in Samara, you gave us in North Caucasian and as well as other university also we have our own contract. So how you feel about our services?
Study Palace Hub, I feel that because we have seen many other partners, everybody working all over. You can see like there will be number of people working all over in the Russia. But especially Study Palace Hub, they maintain their coordination, the quality of work, the genuinity, the truth they genuinely say about the university's hostel and the service they're providing for the students. It's really great because they won't give any false promises. They will always try to stand on their words.
And I will also say, like I will also invite everyone who were watching the video, maybe our student or maybe our consultant or any of the consultancy who wants to visit Samara State Medical University or the university where if you want to visit any university, please, you are always welcome. We will help you for in whatever manner we can help you. We will help you to reach out to the university and you will have really best to best service and support from us. And yes, we have our best relation with the future doctor and they are also too much supportive to us. It's not possible to give 100% best service, but yes, he never complained about anything. Yes, he just requested and we listened them and we solved the problem. And this is the way we work. Yes, everywhere there will be some problem, some kind of problem. And yes, your student also had few problem, but yes, we try to sort out as soon as possible within 1 to 2 days.
No, I need to say that whatever the problem, definitely as he mentioned, Everywhere there will be problem. There's nothing like that 100% true. But the main thing is that see how they attend to the problem, how they listen to us, how they coordinate with us, how they solve it. That's the matter. So whenever there's a problem, definitely they are there. They attend.
Better education for individual work. Also here we may see the specimen of bone of adult person, free low limb girdle, pelvic bone, hip bone. Also we have here the bones of child. For example, it's a bone of adult person. It's a fusion of three bones, iliac, ischium, and pubic bone, and you may see the separated bones in children. For example, a child separated iliac, ischium, and pubic bone. For example, the free lower limb of fetus.
I can see that like you have different, like you already arranged them that are like adult bones compared to the male bones, female bones, and even the pediatric. So students can get to know the difference.
Not only for pediatrics, sorry, because it's also for general department for compare the anatomy between children and adult person.
Okay.
And
Also
sir,
for better understanding.
it's not only department. It's called also anatomy museum.
Anatomy
Yes, I
is
can
part
see
of
it,
department, of course.
It's not only department.
Yes.
It's also called anatomy museum.
Also, yes.
It is. It is.
And we also have here the specimen of joints, lowly knee joint, for example, knee joint after surgical operation, knee joint, foot joints, and also mummy of femoral joint, and artificial specimen of hip joint here, and mummy of hip joint here.
I'm heartily thankful for the Dr. Rakesh, Dr. Shubham, and Dr. Anubhav for providing me this best opportunity to have a better tour at the anatomy lab. I thank you so much.
Vessels and nerves.
This is really very interesting and advanced technology
Yes.
for the study.
Also, you may name the organ, for example, with this element and press humerus.
Nice.
It's like puzzle.
It's
for
very
students.
advanced study.
To check
yeah?
knowledge, for check knowledge.
Very interesting, very interesting. This will benefit the students in the next level because this not just giving them the good experience, it will help them to get themselves educated and they can practice on it. And if they don't know, it will give the answers also. So they can mark, they can do experiments, like they can study by like point to point. Each skeletal system, nervous system, muscles,
All the
system,
systems.
everything is there. It's really very interesting. That helps our students a lot.
Yes. So what else? Also, we may turn it, and also we may switch on, for example, radiology.
Okay.
And so the students may view the real MRI or CT examination of humans, for example, neck region. Let's switch on this and view the real images of MRI examination. And also they may view simultaneously the pyramid anatomy and see the structures here and understand what it is. For example, third cervical vertebra, and they also may view it in model of Pyragov table.
Nice.
We may try. So they also study MRI and CT and understand where is it in a real person. Okay.
No, actually, because radiology is the difficult part.
Exactly.
But this made it very easy for the students
Not
because
so easy, but easier.
no, because it's very simplified
Yes.
and they can study like in detail. Because in radiology, the pictures and the Excel scans, most of the students they say it's difficult to read, but this is in a simplified way. They can once they can study on it, they can study like they can see the Excel inputs better. They can read them better because they will be practicing on it.
Yes. So we may switch off the borders of structures and switch over them for understanding real specimen. And neurosystem, head and neck specimen, vessels, nerves, heart, brain, spinal cord. Next is bronchology, kidneys, reproductive system, urinary system, reproductive system, also digestive and respiratory system. Okay, we may view the specimen here, for example, the vessels of brain, movements of neck region, chest, also the vessels of carotid basin and subclavian basin. Here we might see the heart specimen, also moving heart specimen and heart specimen.
So you can see heart.
The vessels of heart. Here in return we may see the specimen of diaphragm, spinal cord, so nerves of neck, pharynx, nasal cavity, neck, pharynx, neck. Okay, so I told you about these part of specimen. Temporal bone, hearing, also inner ear, medial, also orbit, nerves of orbit, pharynx, nerves of thoracic cavity, for example, sympathetic trunk, aorta, intercostal nerves, sympathetic trunk, also the nodes of sympathetic trunk, the muscles of back, for example, the muscles of thigh, inguinal canal and femoral triangle.
Nice, like actually we study this just in the diagrams. It's a very rarely we can see like a triangle, inguinal canal.
But it's better for understanding if we view this specimen.
That's why.
Yes, it's rare for real, for more the university, but we have this.
Yes,
rare
because I
specimen
have
for
not
this.
seen this anyway. Most of the
It's
universities.
not so good for your practice. Okay.
It's good.
But students may see, understand what the dangerous region is located here, because arteries and veins located under the skin and fascias. What is better for your state, Daniva or Supriya?
Both. Then what? Yes.
Okay, Daniva, okay. So here we may see the rectum, colon, large and small intestine,
Okay.
stomach, duodenum, pancreas, liver anatomy, gallbladder anatomy, also mummified liver of cat.
Okay.
In compare anatomy of tunics, mucous tunic of esophagus, stomach, duodenum, small intestine, ileum, and colon. 6 specimens.
That's very interesting.
Yes.
You make everything side to side so they can make it differentiate and they can understand it better.
For a better understanding for our students, of course. So we have here the specimen of respiratory system, initial parts, also larynx, the cartilage of larynx, the nasal cavity, nasopharynx, and for example, the larynx of cow.
Okay.
It's bigger than the larynx of humans. Also trachea, bronchi, thyroid, trachea, bronchi. And here we may see the teratology.
Okay.
Teratology. The abnormalities, for example, Siam tweezers, yes, marmaid, symptom, marmaid, the absence of 2 legs and they fuse into one tail, like tail. Also the cranioschisis here, edema, fetal edema. Also labium leporinum, the cleft inside the upper lip.
Upper lip, yes,
Upper
yes.
lip, yes. Hydrocephalic syndrome, edema of right low limb, die by, yes, right and left.
Yes.
Okay, so also the anatomy of fetuses and newborn.
Here is going on already for the kids. Namaste.
Здравствуйте.
Here are our students, so they have nursing praxis. First grade patient.
Я второй
They
курс.
study emergency, ambulance or specimen, artificial specimen here, and they elaborate the practice for what. Very incredible country. So we just arrived to work.
Okay.
It's
So
our
we are
cadaver
not more
class.
sure actually, like more. Okay.
Okay, it's a non-official term. It's cadaver class.
Cadaver class. Okay.
Yes.
So
So we
I have a question that do students get chances to dissect the bodies, cadavers? Okay.
Okay, yes, of course. So we have displays for translation, 3D atlas of pyrogoph anatomy.
Okay.
We plug notebooks, laptops, and translate
So
these
which we
atlas.
saw in the.
Yes,
Okay.
which we saw in
that-
classroom. We may translate these atlases to these displays, and students may work with 3D atlas and a real specimen.
Okay, they can see that 3D anatomy models and they can work like
Yes.
on
They compare
directly.
the anatomy.
Okay, they can compare and they can see in the realistic.
Okay. What we can see as here, this is we may switch on it. Also we have camera.
Okay, to record.
HD, to record and to translate. It's IP camera for
Okay.
translation over the world.
Okay.
If Indian students may be located in India and have no chance to arrive to Russia, maybe
For online class.
during 1 month, maybe during 2 months, we may translate our classes
Okay.
over the internet to all the world,
That's good.
all the countries. Okay, we have this possibility for education. Also, we have corpses here. We have what we may wash the instrument, lancets, forceps, for example, for working. Also, we may use the individual specimen of kidneys, lungs, of hearts, brain. Also, we have internet here, internet sets, electrical sets for additional instrument, additional equipment for students. Also, we have them here sets. They may the instrument, additional lamps, for example, torches. Also, we have this. Then wash the specimen, wash the corpse, cadaver, if it's necessary. Okay, I will show you the corpse store. It's here. This task.
So here you can see the corpuses which are stored.
Yes. We may see the corpse store.
Okay.
And also the tank. So you may see that we have the
Okay.
or take them. Yes. And next it goes to this tank and wash here.
Okay.
Also, we have there is the room for reset for entrance, new corpses to our work. Also, we may spend our classes here with corpse. Also, it's maybe switch on. We also may spend our lesson here. This tank is for body specimen.
Body
For
specimens.
scalps,
Okay.
for individual bones, femoral bones. So It's boiled here, and after few days, we have new body specimen for our students for our classes.
Now our Indian students get to know that because they think that in Russia there will be no practical exposure. They mostly think
But we
that
have.
yes, that's what, because by seeing like we have like you have corpus like corpse store here, so like you can get to know that like Russia is not only that you can just sit in class and study by diagrams or just by models or not just by mannequins. You can see their real bodies here,
Real
real
clinical
cadavers
exposure.
here. Yes, they have many corpuses which have been stored, which even we can't see in India. So they have more good facility for the anatomy study.
Exactly, thank you. Okay, so we have two tables on display, and also we have fridge for freezer specimen. Okay, let's go. Let's, Let's compare anatomy of skulls, pikefish, catfish.
Okay.
For example, it's a horse's skeleton, pig skeleton.
So different types of skulls.
Yes, they compare anatomy between human, monkey, animals, fishes, mammals. For example, this is a dog skeleton, cat skeleton. I may switch on to right just a moment. Real bones, separated bones, and complete skull,
Okay.
separated bones. Also the bones of vertebral column, the bones of upper limb, upper limb bones, lower limb, vertebral column, chest skeleton, separated ribs, separated collarbone, sternum bone, vertebrae, sacrum bone. Also we have here joints, the connections between bones, ligaments, synovial joints, clavicle, sternum bone, the joints of neck and skull, the restoration of face with an original method of Gerasimov, academician
Okay.
Gerasimov, professor.
Oh, usually, sorry to interrupt, sir. Like usually, students think while studying they won't get skulls or bones to study, but by seeing here, I can see that like a lot of like very varieties of those like skulls, and you have been already differentiated like upper bone, lower limb, humerus, ulna, and the vertebrae. There are many good collection of the bones and
Okay.
skulls, and not only humans. To compare the like skeleton system with the different like anatomy like other animals, you have their skeleton system also.
For better understanding
better
what the anatomy,
understanding.
what the difference between skull of animals and skull of
Yes,
humans.
yes. So you can just see here, not only the skull, it has like with coordination with the human face and how the skull will be accordingly. So it will be really helpful for the student for better understanding and the interactive
Yes,
studies.
exactly. Right. So this is original method of restoration of face anatomy under the craniometric parameters. Craniometric parameters. Also, we have here the joints of upper limb, a shoulder joint, elbow joint. Elbow is koni.
Connie.
Koni is in Hindi, yes. Koni joint. Also the kalai joint. Kalai.
So the students are accessible
very-
to study for this. They
Yes.
can use these bones for the study and
There are 3 times they may go to this specimen and you individually,
okay,
and also they may take picture
okay,
via this QR link
okay.
in HD, high definition resolution
Okay.
for their gadgets.
You say that if they scan this
You may
QR
load, yes,
on their
this.
mobile phone, they can see the
Exactly.
Okay, that's
They may
good.
use these specimen in